Hello, Central Texas. It's great to be with you again. It's been several months since my last quarterly update. It was around October 16th. So I do have quite a bit I want to update you on today, and I'll try to spend some time on what I think are the most important things for you to know. So there's a lot happening at the national level and quite a bit happening at the local level. So we'll start at the national level. There's been quite a bit of good news over the past quarter about what's happening in VA and in VHA. First, many of you may have received an email from me and from the Secretary, Dr. Robert Wilkie, inviting you to participate in our celebration of being ranked number 6 across all federal agencies for the best places to work. Now that's a significant improvement for VA and for VHA when you take into account that in 2014 and 2015 we were ranked near the bottom by federal employees as best place to work. So I want to acknowledge the efforts by your senior leadership team, by your supervisors, and by many of you to improve the work environment, and also congratulate our peers across the country for helping VA achieve this significant milestone. There was also additional research that came out from Dartmouth University that I know Secretary Wilkie and Acting Undersecretary Richard Stone wanted to ensure that senior leaders and staff were aware of. This particular study by Dartmouth recognized VA for providing a higher quality of care, or at minimum an equivalent quality of care for our private sector counterparts. Now this isn't the first time we've had a university or a private entity such as the RAND Corporation identify VA as providing high quality care, but it's nice to see that as we as a healthcare system are continuing to improve access, we're also continuing to be acknowledged for providing high quality care. So again, kudos to all of you, and kudos to your peers across the country for helping us continue that recognition. We're also beginning to see more and more data from CMS, or the Centers for Medicare and Medicaid Services, that are allowing not just VA employees, but also our patients and our stakeholders to compare the quality of care and the satisfaction with the care between VA and our private sector counterparts. The very first such report came out earlier this month in February that allowed us to compare our inpatient satisfaction scores and several inpatient clinical metrics such as complications and mortality rates, etc., with our state averages and national averages. And I'm proud to report that Central Texas competed favorably both in inpatient satisfaction and in our inpatient quality metrics. So again, kudos to you. I've shared that data with your service chiefs and would encourage you to speak with them and take a look at that data for yourselves. There's a lot to be proud of there. Now, there are some legislative changes that I know I've talked to you about in the past that are beginning to take form, and it's important for all of us as VA employees to understand how these are going to impact not just us as employees, but also how they're going to impact our staff and many other stakeholders that we interact with. One that I've talked to you about in several quarterly updates is referred to as the Mission Act. This was landmark legislation that was passed nearly a year ago that's really setting the stage for increasing the number of veterans that have access to care in the community. But there's a specific parameter of this new legislation that was recently clarified, and it's important that we all understand it. And here's that clarification. Historically, many of us that work with our purchase care programs recognize that veterans have had access to care in the community under a series of conditions. First of which was a 30-day wait time. So if we weren't able to see a veteran within 30 days of what's typically been referred to as a clinically indicated date, that veteran was eligible to choose whether they wanted to seek care in the community at VA expense, or if they wanted to wait for the VA care that their clinician indicated they were required or that they needed. The other way that veterans were eligible to receive care in the community is if they lived a certain distance away, and we typically refer to those veterans as 40 milers, meaning they live more than 40 miles away from a VA facility. But there's some changes to those parameters that are likely to take effect in June of this year that's important for you to know. So here's the first change. The 30-day wait time that we've historically used is going to go down to 20 days for primary care and mental health, and to 28 days for specialty care. But there's another caveat that's being added. Instead of using a 40-mile commuting radius for veterans, VA has come up with a 30-minute and 60-minute drive time standard. Now, these drive time standards are very similar to what Medicare and Medicaid use for their contract providers. And in actuality, VA is getting in line with industry standard, but it will be a change for us. And that change is if a veteran lives more than 30 minutes away from a VA facility that can provide primary care, they will be able to choose if they can have that, they will be able to choose to have that primary care paid for in the community. It will be the same for mental health. If they live more than a 30-minute drive away from a VA facility that can provide mental health, they will be able to choose if they drive to VA for that mental health care or if they want to receive that mental health care in the community at VA expense. For specialty care, that drive time parameter is 60 minutes. So again, these are changes for VHA and changes for us, but it's important that we understand that there are going to be impacts on the institution for the number of veterans that will have the ability to choose their care in the community. And now these will be significant changes. I can assure you that myself and the rest of the senior leadership team and your service chiefs have been planning for this and have done everything we can in our resourcing model to push as much as we can to areas like primary care and mental health and certain specialty services to ensure that they're staffed at the level necessary to accommodate the veterans that we would like to continue to choose VA. But ultimately, the choice is the veterans. And I'll tell you, what I think is going to make a big impact on the veterans' decision as to whether or not they continue to choose VA for their care or if they choose care in the community is going to be the patient experience. Now, the week of February 4th, I had the opportunity to attend the very first patient experience symposium. This specific symposium had representatives from every VA facility across the country, nearly every VHA program office. We had the undersecretary there to speak with us and a myriad of other dignitaries. And we all got an opportunity to talk about the patient experience, share best practices, and look for opportunities in our individual facilities to improve that patient experience. But at the end of the day, there's two things that are going to help us improve the patient experience. One is improving the employee experience. There's inexplicable data that links the employee experience to the patient experience. I know I've made investments in our governance structure and staffing levels to try to move us in the direction of continuing to improve our employee experience. But it's also going to require leadership engagement and obviously staff engagement to be interested in improving the veteran experience, but also improving how we interact with each other. There's also direct correlation between use of modalities such as whole health. These are things like Tai Chi and yoga and acupuncture. And a lot of facilities who have seen significant improvement in their overall patient experience are very aggressively using these modalities. So we've made investments here in whole health. We are actually going to be standing up a whole health department under the Chief of Staff's office and look forward to seeing that department continue to expand and offer veterans an opportunity to self-refer to these programs such as Tai Chi and yoga like I referenced, so that we and they are partnering in their whole health. Last but not least is resourcing and accountability. So I told you that we've made significant investments in resourcing several clinical services to ensure that they have a staffing level that allows them to improve the veteran experience and the employee experience, because there's also inexplicable data that links veteran access to care with satisfaction. So in areas like primary care and mental health, I can assure you we have not historically invested in those areas the way that we should. But we've made those investments this year, and we put the pressure on those clinical departments and on human resources to ensure that we're getting the staff here to both ensure veterans have access to care, but to also decrease the work burden on the staff that we have. So now we'll talk a little bit more about some of the updates here at the local level in Central Texas. So I'll start with a few key leadership announcements. So some of you may have seen the email that we sent announcing our new Associate Director for Patient Care Services, Ms. Catherine Davis. I can't tell you how excited I am to have Ms. Davis joining us. She's coming to us from the Orlando VA Medical Center and just brings a myriad of experience that I think is going to be very valuable to this institution. I've been in constant contact with Catherine. We expect her on board sometime during the month of March, and once we set a firm start date, we'll be certain that everyone is aware of that. But I really look forward to her joining the team. Many of you may have also seen the announcement for our Deputy Chief of Staff. Dr. Solomon Williams, our Associate Chief of Staff for Mental Health, was selected for our Deputy Chief of Staff, and Dr. Williams is already getting actively engaged, and I believe he's going to make an immediate contribution in his new role. Given Dr. Williams' selection as the Deputy Chief of Staff, Dr. Fred Willoughby has been appointed as the acting ACOS for mental health while we continue the permanent recruitment for that position. I also want to congratulate Dr. Mohammed Vasquez. Dr. Vasquez was selected as the ACOS for physical medicine and rehab, and I've already heard a lot of positive things about Dr. Vasquez and the impact that he's having on that service, and really look forward to his continued success. Last but not least, this was a selection that was made quite some time ago. I know we announced it in one of our staff meetings, but I don't recall if I announced it on one of my quarterly updates to you, and that's our new Chief of Human Resources. Many of you know him, Jim Apley. Jim has been our Chief of Employee and Labor Relations, has been with the organization for a number of years, and I was proud when Jim was selected as the Chief of Human Resources, and he's been doing a great job in that capacity. A few other brief updates at the local level. Some of you may have seen some very positive press that we've received about our Waco housing project. We announced in the Waco Tribune, and we had several media outlets there in early January when we announced that we were approved for a new veteran housing development on the Waco campus. Several days ago, I had the opportunity to go to the Waco campus with staff from VA Central Office. We had a public hearing and gave veterans and stakeholders an opportunity to give us comments on what they thought about that proposal, and the comments were resoundingly positive with a lot of support. Local developers that attended the meeting already seeking insight into how they may solicit bids for that housing development. So look forward to it. It's going to be a housing development of no less than 35 units, so housing no less than 35 veterans and or their families. Could be more. Look forward to that as we get ready to post a solicitation. We'll be certain that we keep you all up to date on the progress. I'd also talk to you historically about our PTSD program and our women's military sexual trauma program, and some movement of those programs. That's taken place over about the last year. I am pleased to announce that we did successfully relocate those programs, and we moved our women's military sexual trauma program and our female domiciliary beds successfully to our Waco campus. Have since expanded that program from a total of about 8 to 11 females that we had capacity for here in Temple, and we now have capacity for 30 on the Waco campus. So a lot of positive press there. We've got a number of veteran service organizations that have been involved in offering their assistance to make that new population in Waco feel welcome. And I want to give special thanks to the staff that were impacted by this move and their flexibility and the new skills and competencies that they were trained on. But also want to acknowledge our our engineering department for this significant effort that they put into renovating that unit there in Waco. It's beautiful, and they should be very proud of that. As many of you know, here in the Temple campus, we do still have our canteen under construction. I appreciate your patience with that construction project. We'll keep you up to date as it's nearing completion. And I also want to congratulate our CLCs. Many of you may have seen an announcement that our Temple CLC officially received a 5-star designation. That's outstanding. That's up from 4 stars in the third quarter of FY18, and in the fourth quarter data, they were officially designated as a 5-star CLC. And also kudos to Waco, who had received a 3-star designation, and as of the fourth quarter have now received a 4-star designation. So we're making a lot of progress. Finally, as many of you may know, I will be leaving the Central Texas Veterans Healthcare System to assume the medical center directorship for the South Texas Veterans Healthcare System in San Antonio. My position there will be effective March 3rd. Effective on the same date, Andrew Garcia, our Associate Director, will assume the interim medical center director here in Central Texas. I want to thank all of you for your patience, for your partnership, and for your perseverance. over the last 2 years with me here as your medical center director. You've accomplished a lot from the construction projects that I've talked to you about and some of the improvements in performance. You have a lot to be proud of, and I have no doubt that your success is going to continue. I look forward to cheering you on from afar, and ask you to stay in touch. Thank you, Central Texas.